WBZ's Dr. Mallika Marshall has been a trusted source of advice all the way through the pandemic. She joins me now live. And Doctor, you're still getting a lot of questions from viewers, so let's answer some of them tonight. Andrea writes, if someone had both Moderna vaccines, then finds out they have an autoimmune disease, will they be getting a Moderna booster along with the annual flu shot, shingles, and pneumonia vaccines? Would that compromise their immune system? That's a lot of shots.
That's a lot of shots. I hope you're not getting them all at once, because that might be painful. But, you know, getting a vaccine really should not compromise your immune system. However, if you are immunocompromised, either due to an underlying condition or medications that you might be taking, you may not mount a robust immune response. In other words, you may not make as many antibodies as someone who's not immunocompromised. And depending on your age, you would probably benefit from each of those vaccines listed. But of course, discuss your concerns with your personal physician.
All right, Cheryl is 76 and had the Moderna vaccine. She asks you, doctor, now that it's getting colder, is it all right if I eat inside at a restaurant? I would be dining with people who have also been vaccinated.
Oh, I know. We all want to eat in those restaurants. Well, you know, I would say that you have to weigh your own personal risks and benefits. If you're otherwise healthy and you're fully vaccinated, you're probably well protected against hospitalization and death from the coronavirus. But if you're immunocompromised or you have other underlying medical conditions, it might be risky for you to eat indoors around other people. So when you're eligible for a booster, that will provide some additional protection and give you a little more peace of mind, but you'll sort of have to decide whether it's important to you or not.
I think it depends on the meal. and what you're going to eat.
Well, don't eat in a bad restaurant.
Yes, that's right. I mean, if it's just a cup of soup, it's not worth it. But if it's a steak. Mike wants to know, why isn't there a vaccine being developed to just target the Delta strain, since that's what's so highly contagious?
Well, Mike, you are thinking along the same lines as many vaccine manufacturers, because they really are studying different formulations that are more specifically tailored against the Delta variant and other variants that could come down the pike. But of course, given the immediacy of the pandemic, health officials want to make sure to protect people as quickly as possible. Those formulations are not really ready for prime time yet, and probably aren't really necessary right now, because the current vaccines have been shown to provide excellent protection against hospitalization and death, even against the Delta variant.
All right, Mike writes in, I'm a little worried. I see it's possible to get a booster for the J&J vaccine, but where I live, only the Pfizer and Moderna vaccine is available. I'm hoping that they're going to approve a mix, and it sounds like that's what just happened.
Right, so they didn't specifically say mixing and matching, but they made it clear that mixing and matching is probably fine. The FDA just authorized mixing and matching, and the CDC advisory panel just made a final decision to approve the Moderna and Johnson & Johnson vaccines, and basically have said that people who have gotten the J&J vaccine should get an additional shot 2 months after their initial shot, and that it's probably fine to get an mRNA vaccine instead of getting another J&J vaccine.
There is so much information, so many steps
Constantly
to get this booster going. By the way, Dr. Mallika here with her phone and her earpods, because she's been listening to the CDC meetings, which we appreciate it.
Riveting it was.
Oh, I can imagine. Must listen radio. Dr. Mallika offers her best advice, but as always, consult your personal doctor before making any decisions about your health. If you have a question for Dr. Mallika, there are 3 ways to reach her. You can email her, drmallika@cbs.com. On Twitter, her handle is @MallikaMarshall, or you can Facebook message her, Dr. Mallika Marshall.